Hello, lovely people. A very good day to you. This is Dr. Chumisi, and this is the Ghanaian doctor. Today, I'm going to discuss hepatitis E virus infection with us. So, hepatitis E virus and hepatitis A virus together are transmitted from contaminated food and water sources. So, I'm going to do them back to back, and afterwards, I'll discuss hepatitis B, hepatitis C, and then hepatitis D. These five viruses together cause viral hepatitis, which is a very common inflammation of the liver. So viral hepatitis can cause situations where the liver gets shrunken. Viral hepatitis can cause situations where the liver gets a cancer. But usually with hepatitis A and hepatitis E, they don't usually cause these complications where the liver shrinks and the liver gets cancer. They usually cause a mild, or let me say low form of liver inflammation, and then most of the time to they resolve by themselves without any active treatment. Let's go to hepatitis E. How do we get hepatitis E? Usually, hepatitis E is gotten from undercooked pork. So they did a research and they saw that out of every two people who rear pork, one of them has hepatitis E infection. And it's even more common in people who are always handling the pork, very close to the pigs and all that. So that's something to note. If you are always eating pork, especially when it's undercooked pork, you should, be careful and make sure that at least you are taking steps to prevent hepatitis E virus infection. Other sources of hepatitis E virus infection is crabs, shrimps, and vegetables. Especially if someone has an infection, uses the toilet, doesn't wash their hands well, and handles vegetables. So that goes to our market women, goes to our mothers, our sisters, our brothers who cook in the kitchen. So if you are someone who doesn't wash your hands well before cooking, please, this is an opportunity for you to learn to take steps to wash your hands carefully and properly before you cook. Let me digress. When you go out and you shake people's hands, when you go out and you hug people and they come back to the house, please take time to wash your hands. Don't bring in all the viruses you pick from outside into the house because you may end up infecting your son, your daughter, your husband, your wife, and that beautiful grandma and grandpa that are innocently minding their own business. So please, when you go outside and you come back, make sure that first thing you wash your hands so that you don't infect your loved ones with any kind of virus that you may have picked up from the outside. Let me hit you with another fact. They did a study which showed that out of every 10 Ghanaians, 6 of them has had hepatitis E virus infection in the past. So you see that time when you had that fever, that chills, that you thought it was nothing wrong, it could have been hepatitis E virus infection. One final fact. Out of every 10 pregnant women who get this virus infection, 4 of them end up dying. Yes, it can kill in pregnancy. How do we prevent it? Keeping a very good personal hygiene, washing our hands regularly after coming back to the house from the outside, after using the toilet, before we cook, and all that. Keeping a very good personal hygiene, making sure that we shower regularly, making sure that we keep ourselves clean regularly, keeping a clean space at home. These are all going to go forward to help prevent this infection from happening. In case you have this infection, most of the time there are no symptoms. If symptoms come, it can come with some yellowing of your eyes, can come with some pain around your liver, which is in the right upper area in your abdomen, can come with some general unwellness where you are vomiting, nausea, sometimes diarrhea. In some people to constipation. So all manner of different ways of presenting. In a few cases, it can actually be very severe and affect your liver, cause liver failure, but that's not so common. Most of the time, it doesn't cause liver failure. And then most of the time, too, it resolves by itself without any active treatment. If you go to the hospital and we realize you have hepatitis E virus infection, most of the time we will advise you to make sure you are eating well, eating a lot of fruits and vegetables, you are getting adequate rest, and all that. In such situations, because of the nausea, it's sometimes difficult to eat. So we'll be encouraging you to be eating small, as and when. Eat little at a time so that you don't vomit it all out. In a few cases, like for example, in pregnant women and in people who have a reduced immune system, like who have HIV or very severe infection or cancer, we may give you antiviral medications to manage the hepatitis E virus infection. But in most people who don't have any of these side effects, who don't have any of these complications, who are not pregnant and all that, we will just encourage you to be drinking water, to be eating as much as you can from time to time, and to be taking rest. Let us note, hepatitis E virus infection can kill. So please, if you are feeling any symptoms of general unwellness, nausea, jaundice, just go to your hospital. And also, it may be another more severe, more dangerous form of hepatitis. Go to the hospital, let's find out what it is. If it's hepatitis E and your immune system is strong, we will reassure you everything is good to go. If it's something more serious, we'll treat you and make sure you are good to go. That's all I have on hepatitis E virus infection. I hope you're eating well, you are drinking enough water, and you're taking enough rest. This is a Ghanaian doctor. Follow us for more. Like this video and share it with all your friends. Take care and look forward to the presentation of hepatitis B, C, and D. Bye.